Doody, middle-aged American living in New Jersey near the Lincoln Tunnel. If you were to visit my website, you would type Howdy Doody into Google. You'll find the correct spelling of the famous puppet. You then combine Tom Doody in a Google search for my site. From Healthy Living, Sonora Regional Medical Center. Green means go. Cover story, Beth Twohey. Beth Twohey is my cousin. Back in the swing of things, the medical center's first robot-assisted surgery patient returns to the green. When the retired from teaching at 61, Mary Beth Twohey finally had time to take a swing at a sport she'd long admired, golf. It's something different. I always wanted to learn, she said. She fell in love with the game, and the green of the course reminded her of Ireland, where she loves to travel. Twohey has found the perfect pastime until a painful right knee landed her in the rough. When I started playing 18 holes, the uneven ground really agitated my knee, she says. Began to limit me not only her golf game, but also her daily life. At home, she was troubled doing chores and walking her Cocker Spaniel. An MRI showed that osteoarthritis had damaged her knee cushioning cartilage. It was bone on bone, Twohey said. In order for Twohey to continue golfing and traveling, she would need knee surgery. Fortunately, she didn't have to go far. Specialized surgery she needed, assisted by a state-of-the-art medical robot, was available at Sonora Regional Medical Center. Makoplasty, makeover. When severe or chronic knee pain hasn't responded to other treatments, surgeons must often replace the entire knee joint with a prosthetic implant. But because Twohey's arthritis hadn't advanced to all three knee components, she was a candidate for partial knee replacement, also called resurfacing. The timing couldn't have been better. The medical center had just acquired the technology to offer robot-assisted manufacturing procedure called Makoplasty. Only 160 other hospitals nationwide have this technology. Last February, Twohey became the first person to undergo robotic-assisted knee surgery at the medical center. Her surgeon, Arel Nygard, medical director of the Center for Joint Replacement, spearheaded the effort to acquire the robot system. He thoroughly explained the procedure to Twohey, who also did her own research. She learned that Makoplasty uses a CT scan of her knee and a robotic arm that helps guide her surgeon, allowing him to rebuild her damaged knee with incredible precision through a small incision. The Makoplasty procedure can help relieve pain and enable a return to active living. Compared to total knee replacement surgery, Makoplasty's potential advantages include reduced pain, a shorter hospital stay, a quicker recovery, less implant wear and loosening, better range of motion, and more natural feeling knee. Prior to her surgery, Twohey attended a joint replacement class at the medical center that helped her prepare for both surgery and recovery. When it came time for surgery, Twohey was genuinely excited. Quite a few nurses and doctors attended to observe the new procedure, which lasted about 3 hours. Twohey went home the next day. She started rehabilitation, which included physical therapy and exercises to help strengthen the muscles around her joint and regain a range of motion. Twohey's insurance covered in-home physical rehab for the first week after surgery, but she says doing the exercises taught in the medical center joint replacement class would have been sufficient. Her doctor and physical therapist became pleased with her recovery, she says. After just 9 weeks, she was back to normal activities. Of course, everyone's situation is different, she says, but she moved so well, so quickly, that her friends couldn't believe it. She had just had her knee resurfaced. But even more thrilling to Twohey was this. She received her doctor's okay to practice putting and chipping. She recalls that first tentative swing. I was so excited, Twohey said. It just made me feel good to be out there. She said a personal goal. By early summer, she hoped to be strong enough to visit Scotland, where modern golf is said to have started. Golf is said to have started in Ireland and Ireland for a week, 10 weeks after her surgery. Twohey was well on her way to achieve that goal. I felt lucky to be part of this new procedure, Twohey said. But just as important as the technology were the surgeon skills and the care she received from the center. In a word, she says, the experience was exemplary. From the beginning, everyone at the hospital was fabulous. And Twohey said, I'm extremely pleased with their genuine kindness and professionalism. After you consider partial knee replacement surgery, you could be a candidate for Mechoplasty. To find out, call a joint replacement center at 536-3366. That's in Sonora, California. 536-3366. This has been Tom Doody, middle-aged American living in New Jersey near the Lincoln Tunnel. If you were to visit my website, you would type Howdy Doody into Google. You'll find the correct spelling of the famous puppet. You then combine Tom Doody in a Google search for my site. Thank you for listening. Have a good day, good evening, or restful night's sleep. Ciao.